It's time now for County-Wide, a special presentation of Yavapai Broadcasting News. Join Paul David and Brad Miller as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives here in Yavapai County. And now, here's today's County-Wide.
Well, good day again, and welcome to the program. It's County-Wide. Brad Miller with you, and we're happy to welcome into studio today a couple ladies with the Verde Valley Medical Northern Arizona Homecare and Hospice. I don't think I said that right, but they'll correct me in just a moment. Development Officer Christine Bleicher is here, and Director of Northern Arizona Homecare and Hospice, Loretta Wellborn. And ladies, hello.
Hello.
I massacred the name of the organization.
No, you're fine.
Or was I close enough?
It's Northern Arizona Healthcare and Home Care, and Verde Valley Medical Center it's an affiliate of Verde Valley Medical Center.
Okay, and that's how we're...
Did I say that correctly?
They're all connected.
They're all kind of one. Well, good. Yep. Well, that's how we'll say it from here on out. But I appreciate you coming in to talk today. And we're going to talk largely, Loretta, about hospice care. Verde Valley Medical Center just recently talked to us about really there's going to be some big news, or already is some big news toward that. Tell me a little bit about that.
There is, and we are just so excited. Northern Arizona Hospice has been around in the Verde Valley since 1984. We were a part of the old Marcus J. Lawrence Hospital, and then when it became Verde Valley Medical Center and a part of Northern Arizona Healthcare, hospice just continued in its element to provide hospice care. We are the only not-for-profit hospice because we're part of the whole not-for-profit Northern Arizona Healthcare entity. And, you know, with the ages of our population and especially the population that lives here in the Verde Valley, one of the things that we run into frequently with hospice care, which we primarily do in homes, where people live, whether it's in their own home, whether it's in an assisted living facility, wherever they live. It doesn't really matter to us because people live in a lot of different places. Right. But what is a common occurrence is when, especially people get older, they may not have a caregiver that is able to provide that care in the home. And so we are just so excited about almost beginning our building a residential hospice house right here in Cottonwood. It will be a wonderful facility for folks who are at the end of their life, who need care 24 hours a day and may just not have the family or the caregivers that are able to do that. There are a lot of people that live alone, and there are a lot of people that are elderly. So it will actually be a residential facility where folks can come and live for as long as they need to.
And in that way, it'll be
different
than what you described as the at-home.
Yes.
Let me back up just one notch and ask just a very basic question of you, Christine. When we say hospice care, hospice, what do we mean?
Well, hospice, generally, it means that an individual is at their end of their life and they've been diagnosed by a physician as having a terminal illness with 6 months or less to live.
Right. And somewhere along the way, that happens to a good many of us. And as Loretta described, if family is there and able, and I wonder if sometimes, and in your experience, I'm sure you can answer this question, even when family is available, I don't say burden, but it is, of caring for someone at end of life is going to bring new and different challenges than perhaps caring for that person during healthier times.
Oh, absolutely. It's extremely challenging for families. It's extremely rewarding for families, and a lot of folks really do want to just pass in their own home. But there are times when families need a break too, and and still know that their loved one is going to get taken care of. They still want to know that their special person in their life is going to get the best care possible. And when you think about it, if you're alone if you're the only caregiver for, your husband or your wife or your mother, you need a break too. The 24-hour, it's a 24-hour situation. So at some point, people do need to rest and they need sleep. And so, I think this will be just it'll be like being at home. It'll just be in a special home.
Let's again talk about the caregivers, and we think about, there's probably going to be a lot of medical needs, different things that happen there, but tell me about the emotional end of it. I mean, it's got to be very, wrenching for obviously for the person.
Yes.
But for the family as well.
Yes.
And hospice can help in that regard as well.
Oh, absolutely. The staff is all professionally trained, and they deal with the emotional, the psychological, social aspects, because it doesn't just affect the individual who's very ill, but it impacts the family in many ways. And oftentimes I think it's harder on the family than it is on the individual. And so the staff is extremely caring and compassionate and, well trained in dealing with those kinds of situations.
When we go into hospice care and kind of enter into that, that realm. Walk me through, if you would. I want to talk more about the new facility, but if we're at home and we're able to kind of do that, how does it start? If I'm in the audience now and I might need this service, how does it start?
It can start in a variety of ways. Sometimes we get calls from families that say, you know what, my mom has been diagnosed with cancer. She's very ill. She's not doing so well. Can you come out and do an evaluation? It can be just a call from a family member. It can be a call from a physician. It can be a referral from the hospital. Someone may end up in the hospital and, be diagnosed or be felt to be not have a lot of time left or not have treatment options left. So it can be, the referrals can come from a variety of sources. We take every call. We're happy to send our team out to do that evaluation. And we do work really as a team with nurses, with my social workers. We have a lot of wonderful volunteers. We have our nursing assistants that can help with all kinds of basic personal care for people in the home. So there's a whole variety of care elements that go into that, whether you're at home, whether you're in an assisted living facility, or whether you might be, in the new hospice residence that's going to be built. The care is the focus is always on comfort and quality of life.
Right.
And we never consider that you go on hospice to die.
Yeah.
Our kind of motto is you go on hospice to live fully until you die.
And that's a great way to put it.
Yeah.
But even so, do you ever run into resistance?
Absolutely.
I would
Absolutely. Think. There are folks, and we deal with this on a daily basis, who say, I really don't think I need hospice now. I'm just going to wait and see. Or oftentimes it's the patient, the one that is ill, will realize that they're ill, and I think people kind of innately know. Sometimes, oftentimes it's family members who are resistant, who just don't want to give up. I think they feel like if you become a hospice patient, you give up hope, and you never should give up hope just because you're a hospice patient. And in fact, sometimes patients will come on our hospice service, get kind of their symptoms managed. They'll get their their family all together, and sometimes we discharge patients from hospice because they actually stabilize a little bit, because they've finally got their pain and symptoms managed, and they don't need hospice maybe for another few months.
Sure.
So it can go a variety of different ways.
That really strongly illustrates the idea of making that last 6 months, say, that period of time, as best as it can be.
Oh, absolutely.
If you get into those kinds of circumstances like you've described.
And so we would always encourage people, if you just think you need an evaluation, or you need some kind of help, or you're having pain or symptoms that are out of control, we can always address those, admit someone for hospice care, and if in 6 weeks or 2 months or whatever they're feeling better, they have a trip planned, they want to go do something, and they're completely comfortable, they can be discharged from hospice, and they can be readmitted whenever the time is appropriate again. So it's a real flexible service.
It is. It certainly sounds like it, and all of that points out some parts of hospice I didn't know, and I would guess that maybe many of our listeners didn't either. Our guests, we'll take a short break. Our guests are Christine Bleicher, Loretta Wellborn. We're talking hospice today. Some interesting developments coming to the Cottonwood area. We'll talk about it on Countywide right after this.
Here in northern Arizona and throughout Yavapai County, people count on Orkin Pest Control. With over 100 years of combined experience, nobody knows how to protect your home or your business from harmful or annoying pests like the Orkin Man. To start service, contact your Northern Arizona Orkin Pest Control. In the Verde Valley, call 567-5100 or Orkin Pest Control in the Prescott area at 775-8772.
Hi, I'm Steve Scourge with Yavapai Silent Witness. Maricel Gonzalez was murdered on this spot almost 15 years ago, back in March of 1997. We know that there is somebody out there who knows what happened in the alley that night. Yavapai Silent Witness is offering an $11,000 cash reward for information that leads to the arrest of Maricel's killer. For Yavapai Silent Witness, I'm Steve Scourge.
He's all boy, he's all of 8 years old, and he's all alone, wishing he had a big brother.
Oh, for my sake.
She's been waiting for a big sister for 47 Saturday afternoons.
Oh, for my sake.
You want to do the right thing, and you like to have fun.
You could use the exercise. Oh, for kids' sake, it's good for the heart.
I'm Janet with Credit Union West. We're proud to invest in our community's youth by presenting Bowl for Kids' Sake. Join us, have fun, help kids. Go to azbigs.org.
The pain will not control us. It will never break us, define us, or keep us still. Because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.
Welcome back to the program, again, countywide. Christine Bleicher, Loretta Wellborn, nahealthcare.com on the website, and there's a little work being done there.
Yes.
So I don't know if you have directly a hospice kind of link yet at that place, but you will.
Yes.
At nahealthcare.com.
Yes.
Okay, so that's coming.
Yes.
But folks can find other information there that'll be valuable to them.
Actually, we do have, Loretta, what is it? The Northern Arizona Healthcare, nahealth.com, under services.
Under services, if you click on services and go down, it will pull up a hospice link.
So there is a hospice link there, but we will have a special link just under the foundation and ways to give, and that is under construction.
Okay.
So it should be ready in the next few weeks.
That's coming. The phone number is 639-6100. Do I get the two of you when I call that number?
That's my number.
That's your number?
Yes.
Okay, so we'll talk to Christine, and that's maybe a good place to start. We talked about how to initiate this process, and I guess that would be the way to do it.
Absolutely. Call the number or check on the website, and we are currently in the process of raising money for our hospice home.
Sure.
So
I know there's a big fundraiser coming up at the end of the month. We'll talk a little bit about that in our final segment. That sounds exciting and fun and interesting. But you mentioned that, and raising funds, and that's going to be a never-ending process.
That's right.
To get this going. But can we talk a little about cost to patients and their families? How does this work?
Absolutely. Well, we can go back a few years, I think, back to 2005, and we were actually gifted, Verde Valley Medical Center was gifted with the funds, and they were directed for the purpose of building a hospice home. So those funds now hopefully will approximate the cost of the complete building. Okay. Of course, that can change a little bit, and but for the most part, we are ready. We have the blueprints, and we're in the process of just getting the finalization with the interior and exterior design. We'll be taking construction bids, and we hope to break ground soon. Okay. But given all of that, we know that what our cost will be in the future, those costs are going to surround sustainability, and in particular the operations of the hospice home. Right. And our mission, because we're a not-for-profit, we do not turn anyone away based on the ability to pay. Okay. So going forward, we need to make sure that we continue to raise money for the hospice home so that it can remain financially solvent, and we can continue to take care of everyone regardless of whether they are private pay or Medicare, Medicaid, and we call that our payer mix. Okay. And so there's a different mix of payers, and not everyone obviously will have the same kind of insurance, and some won't have any at all.
Right. Loretto, I talked to a guest one other time about long-term care. Can I buy hospice insurance care? I mean, is there a way to?
I don't know that there's a hospice-specific insurance, but usually if people have a long-term care policy, that would be a type of insurance that would help cover the costs of the care of the residential hospice house room and board.
Right.
Because that's one of the things that most insurances typically don't pay for is room and board.
Yeah.
And so long-term care, private pay, sometimes the long-term care system actually in the state of Arizona, if someone has those benefits, will pay for a place for a person to live or reside, especially if they need care.
Right.
But for a lot of folks, you know, for most of us, it would be a private pay situation where, you know, that becomes your home and you pay to stay there. But like Christine says, for every patient, if they do not have insurance, they do not have the ability to pay, we have a financial assistance process that our organization uses, and we do a significant amount of charity work, and the ability to pay is not a criteria to have care.
Now, is that true for the hospice home?
That's true for the hospice home. It's true for hospice. It's true for our facility.
Gotcha.
For Verde Valley Medical Center. I mean, the ability to pay is not something we ask you when you come in the door and say, okay, you can't pay. You don't have any insurance, so you need to go someplace else.
How cold would that be?
That's just not what we do.
That. That's not what you do.
That's not what we do.
And it shouldn't be.
No.
Yet it is the kind of thing that we all, I suppose, now need to think about. And that's one of the reasons we wanted to do the show today. We'll talk about the fundraiser. We will talk about the home. But it's just to kind of get it thinking about this. We were chatting before the show that I just said, I seem to hear and understand more about hospice care today than for a long time. And you said, well, we're getting, the baby boomers are heading, you know, into the twilight years and that kind of thing. So hospice care is kind of maybe a little more is understood about it seems to me, than maybe even 20 years ago.
I think it is. You see more hospice organizations, and particularly in this Verde Valley, you know, Camp Verde, Cottonwood, Sedona, there are a lot of people that come here to retire. It's a beautiful place to live. It's a beautiful place to retire. The weather's great, and so we do have kind of an aging population in this community, and we all do need to think about, well, if we're going to live to be 85, because lots of people do now, you know, maybe we need to think about what our plans would be, and do we have some resources, and do our kids know what we want to have done, and you know, because we tend to, at younger ages, you just tend to not even think about that.
It's part of the conversation you should have.
Yeah,
we've talked largely about elderly, and I guess a good many of your patients are elderly folks. Not everyone who gets a terminal illness is, you know, sometimes 20s, 30s, 40s.
That's true.
Has hospice served younger patients as well?
Absolutely. We will take care of any age. Fortunately, in this area, we don't have a lot of terminally ill children.
Yeah.
But all ages, you know, young adults, middle-aged adults, people our ages, you know, none of us are exempt from disease processes. So it can happen to anyone, and those situations can almost be more difficult in the sense that you're not as ready and not as accepting of that. So that's a lot of that's where the teamwork really is important, with the medical staff and with the social workers and with the counselors and with the nurses to support the family and the patients when they are of a younger age.
You have a lot of volunteers.
We do have volunteers, and we use them every single day, whether it's to go to a patient's home and sit with them and read so the family can have a break. They may run errands for families. They may help fix a meal. We just use them in a lot of different capacities. They are just a wonderful gift to us.
Will we need more when the hospice home is completed and up and running?
Absolutely.
Probably.
Yeah. There will be lots of volunteer function at the hospice house. Lots of volunteers will be needed. You know, and if somebody just likes to work in the yard and do gardens, or because we're going to have wonderful patios and decks and garden areas, you know, someone might want to volunteer in that capacity.
Sure.
You know, versus being inside, you know, with the patients and any special needs that they may have. So we do volunteer training classes twice a year. We just are in the middle of one right now, and so we will definitely continue to use our volunteers.
All right. We're talking hospice care, and again, Christine Bleicher, Loretta Wellborn, our guests. We'll talk about the fundraiser coming up, a fun event coming up on March 31st. We'll be back to Countywide right after this.
Here in northern Arizona and throughout Yavapai County, people count on Orkin Pest Control. With over 100 years of combined experience, nobody knows how to protect your home or your business from harmful or annoying pests like the Orkin Man. To start service, contact your northern Arizona Orkin Pest Control. In the Verde Valley, call 567-5100 or Orkin Pest Control in the Prescott area at 775-8772.
Hi, I'm Steve Scourgy with Yavapai Silent Witness. Maricel Gonzalez was murdered on this spot almost 15 years ago, back in March of 1997. We know that there is somebody out there who knows what happened in the alley that night. Yavapai Silent Witness is offering an $11,000 cash reward for information that leads to the arrest of Maricel's killer. For Yavapai Silent Witness, I'm Steve Scourgy.
Every year, 2 million kids play doctor by taking pills not prescribed to them. Talk to your kids about the dangers of prescription drug abuse. The partnership at drugfree.org.
Welcome back to the program, Countywide, and we're talking Northern Arizona Home Care and Hospice. Christine Bleicher, Loretta Wellborn today. You've given us, I feel good about this. You know, I thought, hospice, we're going to talk about end-of-life issues, but you've made me feel really, really good, and I hope our listeners understand that as well, that there can be a whole new direction for those of us that are going to be, and most of us will at some point or another, face these challenges. There's going to be a fun event coming up, a fundraiser, later this month. Christine, tell me about that.
Yes, it is. First of all, I just want to say, Brad, that what we're doing right now in terms of building this hospice home, I think it's really important for folks to know that this will be the only residential hospice home in the Verde Valley or Sedona. We do not have one, and I think that's really important to point out because it's just a vital need for our community, and our community really deserves to have it.
Terrific.
So we're very excited about being able to raise money for that, and we are anticipating that we're going to break ground this spring, hopefully very soon. And our first public event to raise money for the Verde Valley Hospice Home is going to be at the Blazin' M Ranch on March 31st, and it's going to be a run. And it's sponsored by the Lovin Construction family. Okay. So it's called the Lovin' Run for Hospice, for Verde Valley Hospice. So it's kind of a nice name. It's got love in it.
I like it. Yeah.
Just a coincidence.
That sounds great. That sounds great.
But we like it. So yeah, Saturday, March 31st, and it will be a 2K fun run walk, as well as a 5K and a 10K run.
Okay. Excellent.
Yes.
March 31, 639-6100. Can you tell me more if I call that number?
Absolutely.
About this event, about volunteering?
Yes, you can come and volunteer for the event. You can come and run or walk in the event to show your support. We also have availability for more sponsorships, so if you'd like to sponsor a team, maybe your corporation would like to do that, or maybe you'd like to be a t-shirt sponsor. So there are different ways of giving and different levels. And of course, you don't have to just give to the run, and you don't have to run or walk if you want to make a donation.
A lot of different ways to become part of this.
Absolutely.
All right, thank you so much. When this opens, we'll talk again. Okay.
Oh, that would be wonderful.
Can we do that when we open our doors and greet that excitement as it comes to our community? Probably about a year's time.
Yes.
Yeah.
Ladies, thank you so much. Christine Bleicher, Loretta Wellborn, our guests. It's Countywide. We'll see you next time.
This has been Countywide, a special presentation of Yavapai Broadcasting News. Listen in each Tuesday and Thursday as we tackle the hot topics and talk to the decision makers across Yavapai County. That's Countywide with Brad Miller and Paul David each Tuesday and Thursday on this Yavapai Broadcasting station.